Next, we will do palpation. It is another commonly used physical exam technique that requires you to touch your patient with different parts of your hand using different strength pressures. During light palpation, you press the skin about 1/2 to 3/4 inch with your pads of your fingers. When using deep palpation, use your finger pads and compress the skin about 1.5 to 2 inches. Palpation allows you to assess for texture, tenderness, temperature, moisture, pulsations, masses, and internal organs. Normally, you should elicit no tenderness on either light or deep palpation of the abdomen. When palpating the abdominal region, be sure to palpate lightly, then deeply, noting any muscle rigidity, masses, or tenderness. Palpate tender areas last. Palpate the liver margins, which is not often palpable, which is in the right upper quadrant. So I will press, trying to feel all the margins of the liver in the right upper quadrant. Next, I will go over to the left upper quadrant, feeling for the spleen, which most of the time you cannot feel and palpate either of these organs. To palpate the kidneys, I will go over to and feel behind her back in the flank area, and then kind of feel at their lower stomach, lower abdomen to try to feel kidneys. A lot of times it is hard to palpate the kidneys at any time. Also, you can palpate the bladder, which is at the top of the suprapubic area, feeling for enlargement or fullness in the bladder, and then just kind of palpate going in a downward motion there. After assessing the abdomen, assessing for any tenderness, abdominal pain, masses, just kind of palpate in different areas of the stomach to make sure that you do not feel any masses or anything. Any tenderness that you feel when I'm palpating your stomach?
No.
Okay. And feel for temperature. Temperature is nice and warm. Skin is dry. She does have a few stretch marks that we inspect, and that is just from her pregnancy. Besides assessing the patient, there is also lab work that is involved in the gastrointestinal assessment. There is common lab values that will help you in your lab assessment of your patient. Lab values should not be looked at individually, but rather in context of a complete abdominal history and examination. Different lab work that you would need to look at in regards to an abdominal assessment would be your lipase, amylase, calcium, platelets, AST, ALT, fibrinogen, PT, which is the protein, albumin, bilirubin, ammonia, hemoglobin, hematocrit, electrolytes, BUN, white blood cells. All of these can indicate different gastrointestinal problems, such as pancreatitis, liver dysfunction, cirrhosis, hepatitis, gastrointestinal bleeding, and many other gastrointestinal disorders. It is important to know these labs and understand them. Digestion, transport, and absorption are the process by which the digestive system supplies nutrients to each and every cell of our body. If there is a disruption to this process, the whole body suffers. Next, we will teach the patient promotion for a healthy gastrointestinal tract. Ways for a healthy gastrointestinal tract would be to eat healthy, low fat, low salt, low cholesterol. Eat small, frequent meals daily. Exercise regularly. Drink plenty of water. Optimize fiber intake. Try probiotics for intestinal health. All of these can support the GI tract. Also, get routine colonoscopies and endoscopies starting at the age of 50 to help check for colon cancer. At any time, if you have any questions, concerns regarding your health, always contact your healthcare provider so that the proper testing and lab work can be done. Ms. Dye, at this time, do you have any questions?
No, ma'am.
This concludes my video for the gastrointestinal assessment. I hope this will help you in your next GI assessment. Thank you.